with Doctor, she hates me when I call her Doctor.
Yes, I do.
Dr. Jenny Wickford. Jenny is a PhD physio, and Jenny's specialty is pelvic floor. And so we've been talking about this idea of pelvic floor and what it is. And so I'm delighted that you're going to be joining me in October for our 5-day dissection in Bristol this year. Woo!
Very
and
exciting.
it's going to be great. So that's a class which is for regulated healthcare practitioners. So that's people that are osteopaths, chiropractors, physiotherapists, and and you're going to do a section on the pelvis. We're going to have one of our cadavers which is going to be set aside specifically for looking at that for a section of the day. So why should they come, and what are you going to do? Justify your existence.
Well, the pelvis is pretty central to the body in many ways. It's something that a lot of us have not really learnt that much about. I know from my training it was pretty much ignored. It just wasn't there. But it's so relevant to everything. So just to get a bit more understanding of it in relation to function in the rest of the body.
Do you carry this around with you? Is this in your luggage? Have you
Always.
You carry a pelvis
I do.
around? Yeah, okay. I love the idea of there being a pelvis, because you've got a pelvis here, and then we've got a pelvis and hips. And so we can identify pelvis, that's gone, and then we can say pelvis and hips. And it's this idea, how have we got to the idea of a pelvic floor? Because I know you're keen, and we're both keen to reconfigure the thinking of the idea of a pelvic floor. And so talk me through this pelvic floor idea and how we got there.
Well, partly through working with clients who have problems or difficulties, pain in the pelvic region, and then very much from the dissections, the whole idea of a pelvic floor makes less sense or makes no sense.
Why? Why not?
Well, it doesn't. It's not a floor. It doesn't look like a floor at all. Functionally, if you think of a floor, it suggests a relationship upwards towards the body, and that's kind of the way it's talked about functionally also. But what about the relationship down to the lower body?
So what would you I know the answer to this question, but nobody else does. What are we going to recall it? What are we going to rename it?
Well, that's kind of a work in progress.
So what's the difference between a pelvic floor and, say, a pelvic diaphragm?
A diaphragm is more dynamic. A floor is solid. It's a base. Whereas a diaphragm suggests a bit more movement, function. And also from this guy who was on the course in March from Greece was talking about the meaning of diaphragm. And, there's a diaphragm has a hole.
Sure.
And that's quite crucial in terms of the so-called pelvic floor.
Okay.
Whereas a floor does not suggest that. Floor suggests something solid.
And we've got structures that sort of are sort of conspicuous by their absence, by not being included in the pelvic floor.
Yeah.
Obturator internus being one of those things. And pretty much anything that's going to attach itself outside of the pelvis is therefore not considered to be part of the pelvic floor, and I can't really work out why that might be the case.
Well, and that's the other issue with when you talk about a pelvic floor and you isolate your treatment to that structure without realizing the complexity of it and how it interacts. It has to function with everything else.
Sure.
So if you're just targeting it, then what about the rest?
So my statement that I give out is you can't really have a problem unless you've got a name for it. So give it a name, you'll find a problem for it. Like piriformis syndrome. Or what about, why is piriformis syndrome a syndrome and not an obturator internus isn't a syndrome? Because people don't really know much about the obturator internus, but they see something in a book. So this is the point. It's how have we got to this point that we have these itemized structures that we go and we classify them. We say this is the pelvis and hips, this is the pelvic floor, and never the twain shall meet.
Well, I wonder if part of it is the idea of, because we base a lot of our treatment and ideas about treatment on a model of the body that someone has described. But that model might be, and I think often is, very simplified. And because most people don't have the opportunity to actually do the dissection and look at what is really going on, they don't even see that. They don't ask the questions.
So, so why should anybody come on our dissection then? What's going to happen?
Well, it's probably going to really change everything. It will give a different idea about the body. It will hopefully challenge a lot of what you think you've done before.
Sure.
Which can be a bit difficult, but is also hugely satisfying.
So, so there you go. I think personally, I would say to people, look, it's not an anatomy class. It's an exploration of the anatomy, and trying to reconfigure it and thinking about it differently, think about it functionally. It's really about function, rather than sort of naming parts and saying this is what they do or don't. Your function isn't just this muscle abducts this, and and is innervated by this. It's more about how that connects up with something and what those relationships are, and that's what I'm really keen. That's why I really like your thinking and your approach to this idea of the pelvic floor.
Well, I think with the pelvis, because it's something that it's inside, it's hidden, we don't have access to it in the same way.
Sure.
So the dissection, the dissection is amazing for everything, but that adds a whole different dimension to it.
Yeah.
And it really becomes clear that the models, the anatomy images that we see, are so simplified.
Yeah, sure. I think they have to be. Otherwise, it would just your
They
head
do
would
have to
explode
be.
if you didn't.
But to then take the
point.
next step.
Yeah, sure.
And based on that, see, okay, but there's all of these, and how do we see the continuity in that?
Okay, so not just pelvis, but we're going to talk about psoas as well. Why isn't psoas and iliacus pelvic floor muscles, or it's this kind of
glutes,
glutes,
there's so many other parts.
So this is the kind of conversation that we're going to have. So come and join us in Bristol in October. It's nearly Halloween, so up to that point,
Fabulous.
And Jenny and I will be there to guide you through this incredible structure that we call the human body in a different way, and we're going to hang around in the pelvis for some of that time. Not all the time. We do have a lot to look at in 5 days, and but I'm sure it's going to be amazing. So looking forward to it.
Very much.
See you there.